Hello, this is Dr. Hoi Sung Ki from Wooridul Spine Hospital. Today, I would like to talk about calcific tendinitis. Calcific tendinitis refers to a condition where calcium deposits form in the tendons. As the name suggests, these calcium deposits cause pain and limit the joint's range of motion. The deposits are composed of calcium hydroxyapatite, a substance found in teeth and bones. When this substance appears in abnormal locations such as blood vessels, it causes pain. When it leads to severe pain and joint stiffness, we diagnose it as calcific tendinitis and begin treatment. This condition is most commonly found in the shoulder, but it can also occur in the legs, Achilles tendon, and tendons around the pelvis. Although it is most prevalent among middle-aged women, we also see it in much younger patients in their 20s, as well as in elderly patients in their 80s and 90s. The exact cause is not clearly understood. However, it often develops in ischemic areas of tendons, which are regions with poor blood supply. Calcific tendinitis generally progresses through 3 or 4 stages. The formative stage, where calcium begins to deposit; the resting stage, where the deposits remain stable; the resorptive stage, where the body starts to absorb the calcium; and the post-resorptive stage. When we tell patients, "You have calcium in your shoulder or tendon," it usually means the deposits are already formed and are now being reabsorbed. Most patients experience intense pain during the resorptive phase as the body attempts to break down and remove the calcium, which triggers a strong inflammatory response. Pain doesn't necessarily occur just because calcium is present. It usually starts when the calcium begins to dissolve. During this process, new blood vessels form, and immune cells release various inflammatory substances that cause severe pain. If the pain originates from the lumbar or cervical spine, and is accompanied by neurological symptoms such as numbness or paralysis, it is likely due to nerve compression in the spine. In contrast, calcific tendinitis does not cause neurological deficits, but rather intense localized pain. Patients often say they cannot move because of the severity of the pain, not because of weakness or numbness. In such cases, we suspect calcific tendinitis. A simple X-ray often shows a bone-like shadow in a location where bone shouldn't exist, suggesting the presence of calcium. This can guide diagnosis and treatment. The condition can often be identified through basic tests like X-rays or ultrasound. One of the advantages is that treatment can begin immediately after diagnosis. We don't necessarily remove the calcium immediately upon detection. Although it would be ideal to eliminate the calcium right away, most deposits dissolve naturally over time. In many cases, taking oral anti-inflammatory medication and waiting is enough to relieve symptoms. If the pain is too severe, a steroid injection around the affected tendon can help reduce inflammation and relieve pain. Extracorporeal shockwave therapy is another option. This non-invasive treatment uses shockwave energy to promote calcium resorption. There is also a procedure called barbotage, or calcium aspiration. The term barbotage comes from French and means to stir up. It involves inserting a large needle into the calcium deposit and flushing it out. However, not all calcium can be removed this way. If the deposit is too large, too small and fragmented, or very hard, complete removal may not be possible. Still, in many cases, patients who are unable to walk due to pain often walk out comfortably after barbotage. The treatment is very effective and offers quick symptom relief. Follow-up X-rays often show that most of the calcium has been removed. Not all cases are treatable with conservative or minimally invasive methods. If these do not work, surgery may be considered. In the cervical spine, it is generally not possible to insert a needle due to the location of the calcium deposits. Most are found near the upper cervical vertebrae, in muscles located directly behind the throat. Because this area is located near the nasal cavity, needle procedures are not feasible. However, calcium deposits in this region rarely cause significant pain. We usually reserve active treatment for more accessible joints like the shoulder, elbow, pelvis, or heel. The hip joint is one of the deepest joints in the body, so when pain occurs there, walking often becomes difficult. Patients may present with a limp or arrive in a wheelchair. In many cases, the cause is a disc herniation, but sometimes tests reveal no spinal issues. If the patient has previously experienced disc problems but describes a distinctly different pain and can point to a specific painful area, and imaging reveals calcium, then we begin treatment. In such cases, patients often respond very well to treatment and are able to walk out of the clinic immediately after. The improvement is typically rapid and dramatic. That concludes our overview of calcific tendinitis. Most patients with calcific tendinitis don't come in just because they're mildly uncomfortable. They come in because the pain is overwhelming. This condition causes extremely severe pain, but also responds very well to treatment. If you are experiencing intense, localized pain, we strongly encourage you not to endure it. Seek care early, as timely treatment can lead to fast and dramatic relief. Thank you.